everyone, welcome to Bodyworkers Mastercourse Part 35 on front of the shoulder pain. I'm here today with Sharon Sauer, your Bodyworkers Mastercourse instructor.
Today we're going to learn how to eliminate anterior shoulder pain. So it's going to be, we're going to evaluate the muscles, we're going to look at what muscles cause pain in the front of the shoulder, and then we're going to learn how to treat them. And then also we're going to learn how to do self-care. So it'll be really great. So sometimes, some of the times people have rotator cuff injury, and sometimes their pain is in the front of the shoulder, and this might help them as well. So people who have that, also thoracic outlet syndrome, that you could get relief from the treatment that we're doing here today. Carpal tunnel syndrome, a lot of things that the scalenes would affect. So the muscles that we're going to be working on today, let's take a look at them. Take a look at them over here. Okay, so you could take a look right here. So we're going to be working on the infraspinatus is the most likely one, okay? The deltoid is the second most likely. Scalenes are the third most likely. So for anterior shoulder pain, if you just hit these three, it would be really great. The supraspinatus, the pectoralis major, the minor, the biceps brachii actually come up and cause front of the shoulder pain. Coracobrachialis, sternalis, subclavius, amazing how it causes pain. And again, amazing how latissimus dorsi can come, the muscle that comes all the way from your lower back all the way to the arm that causes front of the shoulder pain. And so this is the muscles, and it's 11 muscles that cause front of the shoulder pain. Isn't that amazing? 11?
11.
11? That's 11? 11? Okay. And then we're going to be doing these range of motion tests. We're going to be doing the number 1, cervical rotation, cervical lateral flexion, scalene finger flexion test, the scalene cramp test, the scalene finger flexion, the shoulder drop, the Wright's maneuver, the mouth wrap, the back rub, the hand to the shoulder blade, arm abduction, arm pull back, and the overhead reach. So we're going to do quite a few tests. That's a lot of tests, isn't that a lot of tests? We're doing that today.
Quite a few. Yeah,
a lot of tests. And remember, next week we'll be doing a 45 protocol back of the shoulder pain. So yeah. That's next week. So today we're going to get started on the front of the shoulder pain. And so let's take a look at some of the pain patterns that could cause front of the shoulder pain.
Okay, sure.
Okay, so let's take a look at the most likely one to cause front of the shoulder pain, and that's from a muscle in the back of the shoulder. Could you come over here, Adriana? Right?
Yeah.
So Adriana is one of our students today. She's becoming a myofascial advocate here. Okay, so dysfunction of the infraspinatus right here causes front of the shoulder pain. Now, in addition to that, it can cause pain down the arm and into the hand, and can cause pain right here on the inside of the shoulder blade, right there. So that's the most likely one to cause front of the shoulder pain. The second most likely one is the deltoid muscle here. So let's take a look at the deltoid, and we'll just turn a little bit more this way. So the deltoid attaches right here onto the clavicle and onto the acromion, and this is its job. It goes in and lifts the arm like that, and I can feel we have a little dysfunction with that. Yeah. So you can feel, if you have your finger on the muscle, you can feel that the deltoid is definitely causing Adriana some trouble there. Yeah. Okay, so you can see the pain pattern that the deltoid has, and it causes pain mainly in the shoulder itself and a little bit down towards the elbow. Then the third most likely is a really, really, really important muscle, the scalene muscles, okay? So here's the scalene muscles right here, and look at the pain that they cause. They cause between the shoulder, they cause it down the back of the arm, down the front. But today we're thinking mainly about the front of the shoulder right there. So that's the pain pattern we're looking at, but it also causes pain all the way down to the thumb and the hand. And it can really cause, it also can cause swelling in the hand. Isn't that amazing? So swelling, you can get significant swelling in your hand. And in addition to it compressing and causing referred pain. Oh, come back here. Oh, sorry. Don't go. Oh, okay. Don't go anywhere. So I'm going to show you where the scalenes are. So you can see here's your sternocleidomastoid. Here's your trapezius. So it's between those two, just here like that, and it comes down and attaches here. Take a look on the first and second rib. Now, if this muscle's too short, it pulls up on the rib and then presses the rib against the collarbone. and then that causes brachial plexus compression, so you can have numbness in the whole arm or portions of the arm because of that. So that's really important. Yeah. Okay, so you can sit down for a minute. She's off the hot seat. Okay, so that's the third most likely. The fourth most likely one, here is the supraspinatus. Can we take a look at you? Come on, come over here, Camille.
My favorite muscle is the scalings.
Yeah, that's your favorite. Her favorite muscle group.
Oh,
Yeah. So here's our supraspinatus. You find that you look for the spine of the scapula and you come just above it. That's your supraspinatus. Step that way for a second. And we're going to just take a look at it. It does the first 10 degrees here. And that's so if you're having dysfunction with this arm, this muscle, sometimes the person would lean this way and then lift their arm up like that. Okay. So this is the supraspinatus. Okay. And so that one here causes pain in the front of the shoulder, and guess where? To the outside of the arm. So also causes, what's that? Tennis elbow. So that right there, the lateral epicondyle. So this is the supraspinatus. And so that's the fourth most likely. The fifth most likely one is here. The pectoralis major and then minor will be the sixth most likely. You see this section of pec major causes front of the shoulder pain right here. So that's this section of it right there. And it causes front of the shoulder pain, and then it could cause some really wicked elbow pain. This one here is called golfer's elbow. Yeah, you've heard of that, right?
I think I have, and I think probably some folks out there have as well.
Yeah.
Golfer's elbow.
Golfer's elbow. Okay, so that's our pec. So here's our pec muscle right here, and that could cause. So the pec muscle can cause golfer's elbow. Now, a nice test for that is just taking the arm back like this. And you can see there's some restriction in the range of motion there. And let's take a look at the test for pec minor. And then here, oh, there it is. I can feel the pec minor is tight too. So we've got a little bit of pec major and pec minor dysfunction. Let's take a look at the pec minor referred pain pattern. Let's see if we can find that. Oh, we're right here at the subclavius. So here's the. This is so exciting.
Oh my God.
Okay, subclavius. It's the 10th most likely here. Okay.
10th most likely.
But look at the pain pattern. See, it's just a tiny little muscle underneath the collarbone right there, right? Attached to the sternum, and then over here to the collarbone. And look at the pain it causes all the way down, almost just like carpal tunnel syndrome. You see? And here it is, Camille. You can see it's just right below. It starts here,
That's very tight.
and it's right below the collarbone, right there. Yeah, and that's your subclavius. And it causes some really incredible pain. I mean, just for such a tiny muscle, you wouldn't think that would cause that much pain. But it does.
Cause pain all the way down into, what did you say?
Let me show it to you.
Carpal tunnel, did you say?
It does. It causes it just like carpal tunnel. Let me show you. So just take a look here. So you could have compression of the clavicle here, the subclavius, and it could cause pain in the front of the arm, down the arm, and all the way into the hand here. See? So isn't that incredible? And you know the kind of, you just take a look at where it is. You can feel it right here, the sternum, just come right below. That's it right there.
Yeah, I feel like they're uneven.
Yeah. Oh, and they may be for many reasons. Yeah. So that one, if it's painful, so everybody could check it on themselves, and if it's painful, that's very likely to be causing some of this pain down into the front of the shoulder and down the arm. Then here's a pec minor. Okay, so it causes really pretty significant anterior shoulder pain. Right here you see, and then down the arm and into the hands. So in the little finger side, so more like on the golfer's elbow side. And there it is right there. So that's the sixth most likely. Let's take a look at the seventh most likely one, the biceps. So let's take a look at our seventh most likely one. Let's see where it is. Our biceps. Okay, that's a 649. There it is. Yeah. Okay, so here's our biceps. Now here the trigger points are low. So here I'll show them on Camille. So if you look, let's look for some taut bands right here. So you could. She has just a couple taut bands right here, but this would cause trigger point. This trigger point would cause anterior shoulder pain right here. So it's way down here, but it causes pain up here.
And that's where I have the sharp shooting pains
It could cause
from
sharp
the car
shooting.
accident.
That's right. It could. So a car accident, because your arm is in this position, it
Right.
might have dysfunction, you know,
Right,
after the car.
because my hand went through the steering wheel and hit the dashboard, so I've got everything all the way
Wow.
up.
So very
from that.
likely that happened during her accident. Yeah.
Yeah.
Yeah, so that could cause anterior shoulder pain, significant.
Hmm.
The 8th most likely one to cause pain in the front of the shoulder is the coracobrachialis. That's one right here. And this is a small muscle. It here attaches to the front part of the scapula, and then here to the humerus. So and look at the pain it causes: front of the shoulder pain, upper arm pain, mid arm, forearm pain, and hand pain. So
Intense pain in each of those.
Oh,
too,
it's
it looks
intense
like,
too.
yeah.
It's like really hot. Yes. So it starts right here on the coracoid process, and then over here it attaches, and then here you can feel it do its job. You can feel, is it doing its job like that? You can, so that's one way of testing it. Okay. Okay, so that's our coracobrachialis. Then our sternalis. Let's take a look at that. Is the 9th most likely. Let's take a look at that one here. So here's our sternalis. It causes pain in the chest, but then down across here and into the front of the shoulder, right there. So that's our sternalis. And we got, already looked at subclavius, but the most very unusual one is on page 573, and this is the latissimus dorsi. So it's amazing, but look at, so this muscle here that starts on the low back, and it comes into thoracic, and then it comes up and attaches onto the in the bicipital groove there over on the femur, on the humerus, and then you can see, but it causes front of the shoulder pain right there. See, front of the shoulder pain. So this is our latissimus dorsi. So let's hear, so you can, now the odd thing is though it's innervated by C6 to C8. So so if you're tight right here, that could cause your latissimus dorsi to cause anterior shoulder pain. So here it is, here's your latissimus dorsi, and it comes all the way over and attaches right here. So that's your, and then it gives you anterior shoulder pain. So isn't that amazing? All the different areas that can cause front of the shoulder pain, right?
Yes.
Yes.
Yes,
Wouldn't have
isn't
guessed
it
that
amazing?
one.
Yeah.
Wouldn't
Latissimus
even
dorsi.
think about the attachment, you know.
So today I thought we could all, I have the range of motion test, and this is what we're going to do today, is take a look at these range of motion tests. So you can take a look at this. This can be downloaded off of the website www.myopain.com, and this would be range of motion test for the upper body.
Yeah, on that note, already have it. We'll be using protocol number 44, which
That's
you can
right.
also find there as well.
Okay, so I was going to give.
Call number
We had a
44.
question. Yeah, here's 44.
There you
That's
go.
what it looks like.
That's
Someone had a
44.
question. Was there any muscle specific to frozen shoulder pain? We'll be going
the
over that.
frozen shoulder muscle.
Oh.
Ooh, that's the frozen. That's subscapularis.
Okay.
But all of the muscles that hold the arm onto the shoulder could be important, you know, so or that attach onto the scapula might be an important piece of frozen shoulder. But the frozen shoulder muscle is subscapularis. And where is that? Let's look at it. Let's look at it on you, Camille, okay? So here's the subscapularis. You come like this and you go back and towards the scapula, and this is its test. You test to see, oh, she passes the test. Look at that. So she's doing this. That's the range of motion test. And that's also, let's see if she can do this. Oh, she's practically a genius here. she almost passes the
No frozen shoulder here?
No frozen shoulder.
She's not frozen. She's doing good.
Okay.
So she's not having a problem.
So
that's
subscapularis.
subscapular. And guess
is the
what that
answer to that
causes?
question,
That causes
primarily.
back of the shoulder pain. It's a really main cause of back of the shoulder pain. So that's coming up right away. Let's take a look at the pain
What about
key.
the infraspinatus?
Well, the infraspinatus is the first one that causes, the most likely one to cause pain in the front of the shoulder. But let's take a look at the back. So this is next time. We're going to look at protocol 45, I meant.
For next time.
Next time.
And the subscapularis here is the 1, 2, 3, 4, 5, 6 most likely, but it's the most likely one to cause frozen shoulder. Yeah, it's the most likely one to cause frozen shoulder. Yeah. So the 6th most likely one to cause back of the shoulder pain. Yeah, but it's significant. It's significant. Okay, so we're going to test each other today. What do you think about that? Isn't that great?
Go for it.
Okay. Okay, so can the two of you test each other?
Sure.
Okay, I've got a page for you guys to work with. right here.
Well, there's
So-
3 of us, so we can't.
Yeah, but there's two,
Test
but
each
there's
other.
only one. So there's two people will be testing at one time. Okay, so the
Okay.
2 of you are going to test each other one at a time,
Okay.
and I'll test her.
Oh, you'll test her? And
Yeah.
we'll
You're
test
pairing
you?
up.
Okay.
We're pairing up.
All right. So we'll follow your lead.
That's good. That's good. We can do that. Yeah. Okay. So great. So we're going to take a look, and so
Oh, we need a.
we're going to look at cervical rotation. So if you could come over here, Mariva, and let's take a look at the test over here. We're going to do the first test. We're going to do a cervical rotation. Come on over. So here, this is going to be for the scalene muscles, and for the trapezius. But this is for all the muscles, but particularly for today's the scalenes. Okay, the cervical lateral flexion, also scalenes, and so forth. We're going to come down and do these here. So
We're doing these.
yeah, so we're gonna rotate the head and note the degree of rotation, and then no restriction. The nose should align with the acromion. That's 90 degrees. So we're gonna do that. Okay, so let's all do that together.
Have another one? Yeah, you've got one. Okay.
So why don't I do it on you?
Okay, so let's have you turn your head to the right. Okay, so you can see from here to, so here's where the acromion is here. So you can see that she's significantly far from that. So you could go her nose from here to here. So that would be about, oops. There are different ways of doing this. Okay, so here you can see she's at that angle. So you can see that so let's go ahead and I'll measure from here to here. So that's 8 inches. Let's go ahead and turn over to the other side. And we're gonna go ahead, and again, it's 8 inches. So another way to do it would be
8 inches on this side. I don't know.
Okay, so where do we write that?
Okay, so the next thing we're going to do is lateral flexion, and we're going to do a little. So here we're going to have her ear come to her right shoulder, and do the standing. And you can see let's measure from the earlobe to the shoulder. Okay.
Oh, you're good at this.
I had my shoulder up.
Oh, is it?
Yeah, put
I
them down.
raised-
Let's not
no, I
hold them up.
lowered it.
Okay, let's go earlobe to the shoulder. So that's
Very
5 inches on the right. Earlobe to the shoulder. That's 5 inches on the left. Okay. So we got a couple. So we're gonna put that in here.
And 3.
Making notes in our range of motion
Yeah.
testing charts.
Testing chest.
How much was that I just measured?
5 inches.
Okay, thank you. Okay, right. Okay,
You
good.
got a long way to go, don't you?
I have a lot of
Okay.
shapes, yes.
But this
Okay,
is
so-
good. You're getting some insight.
What we want to do is now we're going to test cervical flexion.
Oh,
So we
this
can
was
do
right
this
and wrong.
with our fingers. So let's have them go ahead and
Chin?
bring your chin all the way to your chest. Okay. And so you can see how many
100%.
fingers. So here she's got -4 fingers. So she's got -4 fingers, or you could measure it with your measuring tape.
You
To
can
the
go
chest.
you can go all the way.
Am I all the way?
3
Yeah.
inches.
You're
Okay.
all the
So-
way.
So this way here she's
You're measuring from
Yeah, so can you
Well,
check
well,
her? Go ahead.
Yeah, yeah.
you're measuring
that's-
from the center of the clavicle to her chin.
Yeah, so you're just gonna see how fast. So
You got it.
like suppose they could only get to here. So then that's like how many fingers would fit there? That's 4. There are 3 fingers, 2 fingers, 1 finger, no
So
finger.
just on the chin.
Yeah.
No finger.
Good.
Finally.
Okay.
I passed one
I'm an
really
all-finger,
well.
too.
Yay.
So that's 4 fingers.
Okay, so this is
4 fingers.
So you're 100%.
Okay.
Okay, cervical
you pass.
extension. Okay, for this, what you want to do is have your nose go up to the ceiling. Okay, so we're not doing
That
that.
hurts.
Oh.
Okay, so then we just do pass fail on this one, and so she's not gonna. Definitely can't do that. So we're just gonna circle fail
fail.
on the. Okay, the
Yeah.
next one
It's gonna be okay.
Yeah,
Antonella.
you're well.
is the
Sharon,
scalene.
is this a pass?
Is she a passer?
No.
No.
Okay, so see your nostril should be facing the ceiling.
Oh, no.
Okay. Okay, so
The-
they're definitely not
Okay.
doing that.
Okay.
Am I a pass?
Let me see. Pretty good. Let me just look at you from the side here. Okay, go ahead.
What do you want
Yeah,
me to do?
over time.
The same
I just
thing?
want to see. Yeah, yeah, good. So that's a
Yeah.
pass. Yeah, that's a
Okay.
good.
So the
Very
tip
good.
of your nose
Yeah, I've
is...
been doing my
Yeah.
exercises.
Oh, she's been doing her exercises. Okay.
We have
It pays off.
Sakina,
3 good different examples.
could I
here.
have some the goniometers?
I think she brought them underneath your sheet here.
Oh, they're you are.
Here we go.
Okay. So another way
Got
of
'em.
doing it is you can measure. So let's take a step here. So you're going to send your thing there. So here you can measure. There. So you put that right at the nose, and then have your face go forward, your nose go forward. Okay. Now we're going to follow it as it goes up. So nose go up. Okay. So you can measure that she's got minus 80 degrees.
That's a great tool, the goniometer.
Right. Minus 80 degrees. So the goniometer is a good tool as well for measuring. So really important one next, super important, is the scalene finger flexion test.
You like
We
that?
do that all the time.
Okay, so
I never
so
pass
for that you extend your interphalangeal, your metacarpal phalangeal joint, and then you're going to flex all your interphalangeal joints. So so you can see if you could. So what if your fingers are sticking out like that? Then you know that you probably have scalene
Right.
compression.
Pretty good.
Okay,
Pretty good
so,
finger flexion in this group. Looks
Not
like.
too bad, not too bad.
Yeah,
No,
these-
a good way to really
Not
Got a
look at it
little
carefully.
resistance.
Not
So
too
let's
good,
all go
but-
to the hallway and let's check it more carefully.
Sure.
Okay, put your hand right there. You stand here. Hey, come on, girls, come this way. Come on, Linda. Okay, so you're gonna stand here. You're gonna put your hand on the wall because so you get all your knuckles on the wall. Okay, and then you're gonna bend all your joints. So you're gonna stay. So here. So keep your knuckles. So when she keeps her knuckles on the wall, there's a little bit of space. So she has a goal of getting this to keep her knuckles on the wall and have no space there. Okay, let me look on you. Come on this way. Okay, keep your knuckles on the wall. Okay, so you have a little bit of dysfunction in the anterior scalene. So maybe we could correct that, okay? So today we'll see if we can correct that. So here, so you can see when you keep your knuckles on the wall. Oh, she's fixing it now.
So
Was I
that
cheating?
looks pretty good.
Pretty good.
Maybe I should do it with the other
Not
hand.
bad, not bad.
Maybe I should do it with the other
So I've
hand.
got one finger
Okay.
that touches.
So here
Yeah.
we've got a little dysfunction. So here you can see that she's a little spacer. So let's see if we can correct that today. Let's check it on the other hand.
Then it hurts here when I do that.
Yeah. So
The
that's
deltoid?
so she feels it right there. Yes. Let's go ahead. Try it on this hand, and let's see how you do. So this here a little better. Yeah. So the left one's good. The right hand is typically we use it a lot and that often is the mouse arm and everything. So that's definitely a problem. Okay. So it's so important for us to all pass the scalene finger flexion
Yes.
test. Okay. Okay. So let's go ahead and let's mark down our results. So on the right.
People are asking some questions. For the
Okay,
people
great.
asking questions, your instructor today is Sharon Sauer. She's on the camera right now. She's a
Hi.
certified myofascial trigger point therapist.
Yes, I'm a myofascial trigger point therapist,
we
an
were just-
exercise therapist.
Yeah, and we were just doing a finger flexion test, which tests the range of motion for finger flexing.
Well,
the
showing whether you
scalene.
have it's compression of the scalene, showing if the scalenes are adequately long. Because if they're short, they pull up on the first and second rib and cause compression of all the nerves going down into the shoulder, hand, and arm, everywhere. So it's a problem, and also it causes compression of the lymph and blood supply as well.
Yeah, someone's asking if this is medicine. So this is a field that was basically introduced to the world by Travell and Simons. If you're
So this
interested in an introduction,
Right.
you should look up this book. Janet Travell was JFK's doctor.
So this is
and it covers everything that you'd need to know about that. Google is a great resource for some basic introductory stuff regarding this. But we'll be covering some specifics on front of the shoulder pain today.
and this gives you a lot of good information too. This is it
Sharon wrote
helps
this
you with
book a couple years ago with Mary.
with all the
Bianca.
underlying perpetuating factors. So this is, you can just Google my name, Sharon Sauer, and the book will come up and you can get it on Amazon.
So, we did the finger flexion test.
That it's drug-free soft
That's
tissue
right.
neuromuscular therapy.
Exactly.
Drug-free, it's
Exactly.
non-opiate. It's
Right.
not, it's a contradiction to the opiate epidemic.
Right.
and non-surgical interventions.
That's right. That's
that
right.
can restore function.
Yeah.
That's correct.
Full
Okay.
function.
I'll answer
Pain-free full function.
for Coke 021. I'll just answer that last question, but we gotta get back to the focus of the class.
Okay.
You can go to all sorts of different types of schools in order to do this work. You can come at it from a lot of different perspectives, including
do the mouth wrap test
being an
next.
MD,
So you're gonna take your
or
hand,
in
you're
this
gonna come
case,
all the way around
you know,
like this,
Sharon
you can
is
see
a
if you can
licensed
get-
massage therapist. You need to be able to
She's going into shock.
legally touch people. basically.
Anaphylactic shock.
Hey, I can touch
For
my
more
ear.
information,
Right.
Google Trevelyan
You can't
Simon.
even touch your ear.
Okay,
you
so
can touch your ear.
next we're going to do the mouth wrap test.
What are you
okay?
supposed to do?
So this is the
You're
mouth
gonna
wrap
touch your
test.
mouth.
So this you're supposed to be able to count around the center of your mouth, like that. So let's go ahead and we're going to test
This
each
is
other.
hysterical.
Okay, so for Camille, take a look at this.
This is
okay?
funny.
So you're measuring from the middle finger to the middle of the mouth, and so you can put down her right side is minus 3 1/4 inches.
Left side.
Oh, left.
Left side.
This arm here. This is the right arm.
Right.
the
Oh,
measurement
it's
of
the
the
right
right arm.
arm, not
Yeah.
the left
Yeah,
side.
we're-
That's why I said
Okay,
it.
right
That's why I
arm.
said
The right arm is going to the
Right
left
arm
side.
is going to the left
Minus 3
side.
1/4
Yes, correct.
for you.
Okay,
Minus
let's try your
3
right arm.
1/4.
Okay, and you just don't try hard, just do it. Yeah, that's it.
We've got a
Like you do it.
heckler today. What do we usually do about hecklers?
Oh, well, there's, okay, so it's
Okay,
minus
now.
5 1/2
This
inches.
way.
Well, what you do is we'll go in and we'll
Not quite.
delete their name or something. Yeah.
Okay.
Yeah,
I
but-
think we're unable to do that in the middle of the broadcast. So.
Right now we couldn't. Yeah,
Yeah.
true. Well,
Okay, so
someone
this is
could,
the
but I
left
don't know. I can't.
side.
Yeah,
Okay.
feel free to stay
So-
tuned and learn more about it, but
It's about
please don't be
1
disruptive.
3/4.
Thank you.
Up to the middle.
Okay.
Oh,
so,
to the middle?
Yeah.
So minus 5 inches.
inches.
Okay, you can take a look at this. Come over here. So you're going to
Okay.
measure from the middle finger to the middle of the mouth. You can see it's
Now,
5
help me
1/4
figure this one out, because I'm not
inches.
really-
Okay.
Don't
So it's minus. So you should be able to actually come all the way to the mouth.
Okay.
So I'm going to make a note of that here.
I'm not getting this at all.
So 5
You're not
inches. Okay, so, and this indicates the muscles that could be causing that dysfunction here. So the most likely one here is the infraspinatus. So that's one of our most important ones for the front of the shoulder.
No, this is the one.
Okay, so we're going to do the back rub
Where I'm gonna
and the
get-
hand to the shoulder blade test. So this is also, so this is
This is better.
so
This is
here
great.
she can do the back rub. So she's doing the back
The other
rub
one's 3 1/2. That one's 3.
like that. So she's doing the back rub.
Okay, we'll follow behind you.
Okay,
Oh,
but she's
Where we at?
let's do the so we're doing the back rub so you guys can do it. So you should be able to get your hand across to the other side like this.
Did we
Across
do
like
shoulder
this.
drop already?
We didn't do that one. Yeah.
Okay,
We're not
didn't
gonna do, we're not doing all that. Yeah.
Okay, where are we?
This one here. We're gonna do the mouth wrap. We did that
Oh, we
already.
just did that.
Okay, you just write it down
Oh,
now.
I wrote it somewhere else.
All right, we'll just write it down later. And then now we're gonna do the hand to the shoulder blade. We're doing the back rub and the hand to the shoulder blade, 13 and 14.
Oh, back
So
like this?
so here's the hand. So so for the back rub is this one. Watch. You'll be able to take it across like that. That's the back rub.
Oh,
So we all can do that one, right?
Yeah.
We're doing that one,
Looking
right?
We're
good.
doing that one.
yeah.
Okay, the next one is you want to be able to come your hand all the way to the shoulder blade like that.
Keep dreaming.
Okay. Okay, so then you're gonna measure.
Okay.
Oh, that's-
Keep dreaming.
Okay, so
Whoa.
we're gonna measure here.
Oh, here's your shoulder blade.
So
way
you're
up
gonna-
here.
I know.
So you're gonna
that's-
measure to the superior,
Oh, we have to go all the way up to the
the
superior
spine-
crest,
Yeah,
spinous
the spine of the
process.
scapula. Yeah. So you're gonna go to the spine of the scapula, measure to the middle finger, and that's
Middle
5
finger.
inches.
This
Mhm. Middle finger, yeah. And you've got 9
9.
inches. Okay, let's look at
9.
on the right. Okay. And
Right,
then
9.
Mhm.
Where's that? Hand
And then
to
here we go.
shoulder
This one.
blade.
Oh, this one's
Right,
bothering you.
9.
Oh, wow, look at this one.
This
This
Wait,
is
aren't you
nine-
doing the same one?
9
Oh, no,
inches
you're
on
not.
this
No,
one.
this
Okay,
is the left
okay.
one.
I
This
can't
one's
see.
better.
This is the one she can't move.
Spinous
Okay.
process to the
But
middle
this one has
finger.
more pain.
This one is much
So the
better.
left one,
6.
the left one was a fail, and it was minus 9 inches, and the right one was a fail, it was minus 5 inches. Okay, so, and again, these are the muscles, when you fail that one, these are all the muscles that could be causing the trouble. The
you wanna
infraspinatus,
check
the
me out?
deltoid,
I'm
the
not gonna do very
rest of
well
the
on this.
rotator cuff, latissimus dorsi, and the
Do you want me to take my
anterior
vest
spine.
off so you
No.
can see?
So there's a lot of muscles that could be causing trouble. Okay, so we're gonna do,
Right up here.
I think one more test today.
How
Yeah.
high are we measuring? Right here?
We go to the spine of the scapula, so let's go ahead.
Oh,
How do we find it? So we feel it. Oh, there it is.
That's what I said,
So
right
we
there.
find the spine of the, so you go to right here, the
Right
spine
there.
of the scapula.
That's where I was.
Mhm,
Okay,
mhm.
good.
And that's 7.5 inches. Oh, no, 8. I'm
8.
sorry.
We got 8.
8 inches.
We got 8. I had 9 on one.
Yeah. Yeah, so, okay, you have to be able to pass all these range of motion tests if you're going to be able to use your
only
hands,
6.
because you've
Yeah.
got to be able to pass
Well,
every one of
my
these
injury
tests.
one is better than
So
this one.
there'll
Probably
be a
my
lot more
6
tests in the
years
future,
now.
but they're so
You know,
so
a little
important that
faulty
we
for me.
pass all these range of motion tests, and then we're going to be pain free and be able to really strong and be able to use our arms and our hands, the rest of our body, and all the time. You know. Okay. All right. So we have one more test here, the arm pull back test. So we're going to just do that. Let's see if we can.
Yeah, to answer Leslie's question,
Oh,
the
Leslie.
form that Sharon's using to record these measurements is the range of motion testing
Yes.
sheet. Yes, it is available on
the
the
upper
Myo
body.
website, www.myopain.com.
That's right.
You can find it there. Yeah, so we have one for upper body. There's also one for lower body for
That's right.
other classes.
That's right. Okay, so here we're gonna, so we're gonna take. I felt it was
She's
going
doing deep
right
breathing
there like that.
already.
Okay,
Can't
so
go. You won't be
definitely.
able to go back.
So let's all
Yeah.
look at about where it is. So it definitely isn't passing. Okay, so here let's take a look at the other one. And this one, how far does about there? About there.
There's good.
Okay. About
How
there.
far back
Did you
should
measure
it
that
go?
from
Okay.
anything?
Okay, it should go all the way back. Okay. Okay, so we could measure it this way. One way to measure it would be so we could measure it right at the acromion if we want. And we could see, since this is where it's supposed to go, we could measure the distance between here and here. So that's,
45.
so here, so that's to about there. So that's 10, 20, 30, 40, 50, 60, 70, 80, 90, 100. So it's like, it's missing quite a bit of, it's at least 90 degrees missing, almost 90, like 80, 85 degrees.
So how many degrees are you supposed to be able to go back?
90, you're supposed to get it all the way back. Let's try
Okay.
one of you. Let's
Okay.
go ahead and stand up. Okay, you test her. You test her. Sit down. Oh, one of you test the other of you.
Mud Jeff.
Three Stooges go.
Okay, so we got this.
So you're going to take the arm
We're
back.
going to take you back.
Okay.
About
Okay.
to there. Okay.
Okay.
So you can see, so she's coming back. So you want to come back here to about a 90 degree.
So this is a 90-degree angle if you can go all the way back.
Okay, yeah. So this would be, so you want the arm to come all the way to here. So this
Okay,
is.
relax.
Mhm. So it's
Okay.
minus about at least about 70 degrees there. Yeah.
70 degrees.
Yeah.
And
Let's take this arm one back. You see, this one comes back almost perfect, but not perfect, but close. Okay.
Why is that not full
Well,
range?
it's a little bit tight.
You're like, it looks full range.
Yeah. So this left one doesn't pass for sure. The right one is an almost pass. You can put almost pass, right, left is definitely not. It's at least minus about 70 degrees. Okay.
Okay.
You're minus about 85. Yeah.
Okay.
Minus.
Oh, we'll take a look at you. Yes, we
Yeah.
will. Here we go. So here we go. So we're going to go ahead and take the arm out to the side, and then we're going to bring it back. And look at, she's a passing. That's what you call a
Full,
passing.
huh?
Yeah.
Cool.
Okay, so we come on back, and she passes.
I did my exercise.
She did her exercises. She remembered when she didn't pass before, and she
So she wanted you to
we were going
test
do
her.
this tonight,
she knew it.
Oh,
She
she
didn't want
was
it.
ready.
You were
Stretched
ready.
out.
but I couldn't cure everything.
Do you want to
I couldn't
feel her? Just go ahead and have her sit down and feel how it feels.
Sure.
So go ahead and so have her take her arm out to the side. And then you're going to pull it back. You're not going to hurt her.
Yeah,
You're just gonna-
gently come here.
You're just going to take it back, and then see how it comes
Okay.
back. Keep it coming back.
Help me take it back.
Okay.
Thank you. Oh my.
See how it comes back?
Yes.
That's full range.
That's what we're supposed to be able to do.
Yeah, that's full
right.
range. Yeah.
Okay.
Wow.
See.
It's amazing you can do that.
It's like a well-oiled joint there. It's so well-oiled.
I've been
It's
doing
beautiful.
these chair exercises. I've been doing all this in a
She's
chair.
doing everything. Well, it's good in the chair. It's
Not everything.
Yes,
I'm
a very
still
good
stuck.
way.
I'm
Yeah.
still stuck in here.
Yeah. So today let's just look at the ones we just did. We did almost all of them. We missed a couple. Okay, I think we just didn't do the pec one, but it's not on here anyway. So it's not on this chart, but this is the one I like to do for the pec, you guys. Okay, so everybody take a look, do it on themselves. So I like you to get this arm back and go high, middle, and low. If the low one is the one that gives you the anterior shoulder pain. Okay, so let's check it on you. Okay. Okay, so here you're gonna go pull it back there, and that's dysfunctional. A little bit dysfunctional, a little bit dysfunctional. On the left. Oh, sorry, it's too fast.
No, you're fine.
Okay, and then here on this side, the right. So high, middle, low. Let's pass. So pass on the right, left fails. Okay. Then we're gonna look at the.
Now the highs are causing pain on me on both sides.
Yeah. So then that would be the low pec.
The low pain.
Low pec, and that often causes inside the elbow pain, you know, and shoulder pain. Yeah. Okay. So
We have a little question. Someone was curious if there is a booklet or a smaller version of the range of motion testing posters.
This is it.
The posters?
No, I made this up to be the smaller version.
A text version.
Yeah, text
basically.
version, yeah.
So, but there's no, basically you want to get that poster. There's
That's
not
right.
like a smaller version of
That's
that
right, and
poster.
she said that you just get it on Amazon. That you just use, there's a code on the bottom, right here. The code is 0-9653425-2-2. You know, and if you put that code in,
Yeah.
you can get the. So
So
that's the
Those
range of
are
motion testing posters.
The Finn and Shiflet range of motion charts.
Mm-hmm.
You can find them on Amazon.
Yeah, you can get them on Amazon. Okay, so and then the last one is the pec minor. So for this, we're going to listen to our watch like this. So pretend like our watch is ticking. We're going to listen to it. Then we take our arm back like that. That's our pec minor. So go ahead and listen and take your arm back. How's that feel on the right?
Like I can't really do it.
Not perfect on the right. Okay, let's try it on the left. Just do it a little bit. Then it's not going to work, right?
No.
No, she knows it's not going to work.
I'm using my
Okay.
whole body to do the one on
Okay,
the
so
left.
keep your shoulders forward.
It's
Yeah.
not- doesn't
So this-
even do
Okay,
it.
no pec minor on you. Okay, and you.
Well, this is when I start to hear some clicking.
Okay, so noise. So then that's not a pass if you have noise.
And
Okay.
this one hurts when I get
Okay,
there.
so all of our pec minors are in trouble.
Mm.
So I added them to the end of the here because we didn't have pec minor tests on the chart. So I did put them somewhere. Oh well, wherever it is. Here, so we'll put. Let's see if I have. Maybe I put it right here. on
Pec minor, pec minor.
the, yeah. I'll just write it. We'll just write it in. Okay.
Yep.
So we'll just write it in here, and we'll put in pec. There it is. Okay. We'll just put it in. So fail pec minor, right and left,
That's 11.
right and left, and pec major just on the painful side, which the right side. Yeah. Okay, great. Okay, so we did a lot of interesting tests. Okay, now I thought maybe I would treat some of these muscles and see if we could improve some of these range of motion tests. And you could so you've been just tell us a little bit about your shoulder.
I have tendonitis and bursitis in both my shoulders and a small labral tear in the shoulder. I don't have full range of motion in my left, but my right shoulder causes me more pain after about a couple minutes of doing anything repetitive. I get pain here, down to here, and then through my index finger and thumb. And I have muscle spasms and twitches in my whole entire upper back of shoulder.
Well, that's a lot of problems. Wow. Okay, so let's also check one thing we would like to check here, and this is we'd like to check the nerve roots too to see how they're doing.
Oh, yeah.
And look at the ones we were checking today. It'll be 2 through T, so C2 through T1. So all these nerve roots, you can see that they affect all these different muscles in the arm and the hand and the chest. So this is the nerve root. So what we want to do is make sure that the skin can come up, okay? So this is going to be, so we'll do it standing, we can do it seated, and we can do it laying down. So here we're going to see, so here you can see that the skin comes up here, so we do some skin rolling here, but as it's coming towards C4, it's starting to get kind of tight. And then a little bit tight through there. How's that feel? Is that okay, the treatment? Okay. So you can see that she's a little tight through
Right there.
C, yeah, and feels more sensitive there.
Yeah, when
Yeah.
you touch it, it hurts.
Yeah, and then how's it
Is
feel? Does it
C5
feel?
or C5?
Oh, starting about C3, C4. And how's this feel, the sensitivity?
It's okay, but on C4 on my right side
Yeah.
is where I get like a pain that shoots through my eye.
Oh, yes. Okay,
Referred pain pattern.
so that's an interesting referred pain pattern. Let's take a look at that one. It's right here. So come over here. Let's take a look at that referred pain pattern. So this one goes to your eye, but look at the muscle here. So it's called the splenius cervicis, and it goes like
big culprit.
it goes right into your eye. But the part that you were talking about is right there, and see, it causes both shoulder pain right here, and it causes pain into your eye, like a poker from the back of your eye to the front. So this is an important muscle, yeah. But also we were looking at the nerve roots, which is a little different, but both. We're looking at both. Yeah. Okay, so we'll treat. So we can start with
It's also
treating.
in the sternocleidomastoid muscle as well. Get that referred pain pattern to the eye.
Oh, there's so many muscles. There's a lot of muscles that cause pain in the eyes. Okay, so let's look at our poster. So how we can look at all the muscles that cause pain in the eye and the eyebrow. So the most likely one is sternocleidomastoid. Okay, so that's the most likely, and then
The services is third.
yeah, splenius cervicis is third, and so definitely it's an extremely important one to the eye. Very important, and sometimes
And she couldn't do the turning.
That's
she,
right,
She,
that's
she
right.
didn't do that test, so
that's correct. We had a little
that
trouble
might be
with
another muscle.
Yeah. So we'll look at the nerve roots. So a nice plan would be to treat the muscles that she didn't pass the range of motion test, and it would be good to treat the muscles along the spine. So we'll treat some of the muscles that didn't pass, and we'll treat some of the ones that didn't pass on you guys. Okay, does that sound good?
Sounds
Yeah.
like a plan.
Yeah, so we'll try that. So we thought we'd do that, and then we'll do some self-care, and then a little bit of range of motion exercise. Okay. All right. Oh, we missed one test. I'm sorry. One test. One more test. 19. Okay, so let's look at test 19. This one here is the overhead reach, and this is particularly because we want to do the latissimus dorsi test. And so here we're going to go
18?
do
Test
18.
18?
It's 19. It just looks like it's 18. So this one here is 19. The
Oh, I
overhead
see what
reach.
you're saying.
Yeah. So
Ignore this.
yeah. I noticed that. I always constantly am getting the wrong one. Okay, so we're going to have you clap over your head. Go ahead. And that's a little hard to do. Okay. So don't bother. Don't work on it too hard. Okay, good. All right. So if you can. All right. So
Is this a pass?
that's pretty good. Doing good. You're doing good. Okay, so we're doing good with that. And then another way I like to test it is I like to feel the latissimus dorsi. So let's go ahead and let's feel the latissimus dorsi while she's doing this activity. So let's go ahead and I'll show you the activity. So I have you kind of reach over like this and like that. And I'd like to feel the muscle while you're doing it. And then come on down with your elbow down and come on over.
With this one?
Yeah, let's try that one. Let me feel. Oh yeah, you feel a lot of restriction in the range of motion here. Yeah. Okay, let's feel it on this one again. One more time here. And you feel it a little bit on that one.
So
here.
more restriction on the left side.
Yeah, a little bit more on the left. Okay, so you guys, how's it feel when you feel it? Go ahead and feel it on her. So go ahead. So feel her latissimus dorsi and have her pull it down. Feel it coming down. So come on down.
Down where? Oh, okay.
And then so
Down.
contract your latissimus dorsi. Now stretch it. And have her feel it when it's going through range of motion.
Not bad.
You can try it on the other side.
A little bit tighter.
Okay.
A little
So
bit, not bad, but a little bit more on the left.
test number 19.
Oh, wait. Regular.
Yeah, you're gonna go over and then bring it down. Yeah, go over.
Great. So
Little bit.
so we found a few things that she had problems with, didn't we? So we found that she had difficulty with rotation, flexion, lateral flexion,
No.
extension, finger flexion. So there's a lot of things that we could
I've
correct.
gotten a lot of work here lately, so.
So a few things to correct. Yeah.
Yeah.
All right. So we'll take a look at them.
Okay.
Okay. So we'll use the book a little bit as we go along. We'll look at the
This side
muscles.
feels tighter.
We'll move things a little bit. Okay, so why don't you take off this shirt? We'll want to work on these muscles here. Do you have
Just your
anything?
I have a different shirt.
Yeah, why don't you put
I'll
that
be right
different
back.
shirt on?
Well, while she goes and changes, could I think you picked up one of my papers.
Oh, definitely take them back.
I don't know where
Which one are you looking for?
the notes there.
Oh.
Well, I was just gonna remind you guys to like to get credit for this class. You can do that. And oh, okay, here we go. Great. And in order to do that, let's see.
You want to take a face cradle?
Leave it there.
Yeah.
Let's see. What is it that they need to send us in order to get
They
credit?
just need to send us their information on their license, their name, the broadcast that they watched, so that you know which muscles we treated.
You want to repeat that?
Okay, so during the broadcast today, or at the end of the broadcast, at the beginning of the broadcast, if you could email us your name, your license number, the date of this workshop, and which muscles we treated, and then then we'll know that you watched the class, and
then we can make sure that you.
Yeah. And also, if you can give me your handle, we'll be looking for your Periscope handle. We'll be looking for it when you call in.
It's a little reminder for that.
Great, thank you for that. Yeah, that's great. Okay, so good, you changed. Yes. Okay. Okay, so we're going to take a look right now at these little nerve roots here and see if we can't help her with that. Remember, C2 to T1 are the ones we want to look at today. So we're going to take a look at you. Let's have you come over here and lay down on the
Face
table.
down?
Mm-hmm. And we're going to use a little bit of heat on her.
Got some water bags.
Oh, great. Could you come up on your hands and knees for just a second? Would that be okay? Is that too hard?
Yeah, I can't use my wrist very well.
Oh, not your wrist. Yeah.
Do you want a small one or do you want a large one?
Okay. So tell us about your wrist for a second.
So in the past 2 months,
Yeah.
my wrists have sharp pains that sporadically hit them here.
Right there.
Which also makes it hard to do.
To do that.
You can't do a push-up or you can't do anything that uses the wrists.
Isn't that terrible? How could we can't live like that, can we?
We can't.
No, we can't.
No.
To answer the question about how to decide which range of motion test to do, we basically just run through all the tests for the upper body. You can find the range of motion test form on www.myopain.com. You can use the 11x17 pain key chart that Sharon made just to look at the different muscles that may refer pain. And if you're trying to use the correct protocol, the protocol number is 44. All of those things are able to be found on myofascial.com.
So here, when she's laying down, we're going to just do the skin rolling, and you can see it rolls real nice here, but over here, it starts to not roll so easy. So we're going to see if we can just improve that by treating the multifidi and the rotatories, and just take a couple minutes to do that. And then you could be thinking about how you might be able to treat this area yourself. So I'm going to go over here, just going to press in. So we're going to feel the spine of the scapula, feel the transverse processes, and we're going to press towards the spine. Towards the spinous processes, and then towards the transverse process. The spine and scapula is down here. Okay, here, towards the spine, and then towards the transverse processes. So going inward, and then going outward.
So up, in, and down.
Well, we could do that too. We could go different ways, but I was going towards, and then away.
So.
But straight in is good too. Yeah. Okay, so let's go ahead. We go a little lower. So here we're going to go press in and towards the spine, and then away. So in that little, what we call lamina groove often, we're going to press in there. And then we're going to look again. Does it roll better now that we did that? Yes, it does. So we know, even though we didn't use a lot of effort, a lot of pressure.
And that was treating the nerve root, right?
We did treat that, yes.
Yes.
So we're trying, so remember the accessory.
C4 and C5.
So we're going to look today. We're looking from C2 to T1, okay? But in her case, it started about C3, or and C4 was started to get pretty bad. So here, I'm going to just go ahead. I'm pressing in, and I go towards the spine. What do you think of that side? More painful?
I mean, that hurts a lot.
Yeah, she notices that a lot. So this is C3,
Which is
4.
weird because I always have the pain on the right side only.
Yeah. So this is interesting. Yeah. Yeah. And then we're going to come down a little lower. So again, we're going to go towards the spine. Then we're going to come away from the spine. So if these are too tight, what happens is that the multifities and rotatories pull the vertebrae closer together and causes heightened tone in the nerve distribution at that level. So we're trying to correct that. So this is one way of correcting it. Okay, so let's see how we did. So good, 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 good. So a little bit here. See, yeah, she notices it.
I can feel it.
She felt it too. She noticed it. So it's a little higher up, C2. Yeah, here. So I'm going to go towards C3, C2. A little right there.
Right there.
Right there, yeah. We're both in agreement of this spot. So you can feel the taut bands right there. So it feels like little rotatories. The rotatories are only about this big here. Okay? The multifities are about that long. So they're not very big and not very thick. So I'm holding it while she's
spaghetti
breathing.
in the neck.
The spaghetti, little spaghetti.
Little angel hairs.
It doesn't say angel hairs.
Okay, it lifts up much better. Okay, so that's good. So that's just a little thing that we did
Feeling
there.
some improvement.
So we had improvement both sides. So that was good, and it's better there. So we didn't fix everything, but we took away some of the dysfunction that's there. Okay, so we had a lot of interesting dysfunctions, but one that was really, really important was the scalenes. Okay, so we're going to take a look at that. Also, we had another really important one, the infraspinatus. So those were quite important. So we're going to take a look at those. And you were saying how you mostly feel the pain on only you almost always feel the pain just on the right side. Okay, but we had more range of motion dysfunction on the right side most of the time. Yeah, but not in every case. Okay, so let's take a look at some of the muscles here on the right, and see if we can't get her to pass some of those range of motion tests. Okay, in this position, we're going to treat the infraspinatus right here. So here it is, right there. And I'm going to find the spine of the scapula and come just below it and press in. So go ahead, and I'm just going to feel the spine of the scapula, and then I'm going to come just below it. How's that pressure?
It's fine.
Not too painful? Okay, so let's try another spot.
It's okay too.
Pretty good? Okay, let's come a little bit. So here, finding the spine, so we're going to find the spine and just come just below it, and we're going to come, so I'm going to take a look a little bit with my elbow here. So we're going to find so we'll come just down a little bit lower, and I'm going to look for some taut bands. I don't feel anything right there, but I'm going to just look around a little deeper. And let's come down over here. Okay, there I think I find the little taut band.
Yeah, I start to feel that more.
Yeah, so first, for the technique, so I came down, I went a little bit like that. Oh, I found a taut band. Then I came down and I feel the resistance, so I'm just going to hold my elbow right there on the resistance. So I feel the thickness and the hardness. I'm just going to hold it there and breathe and relax while she's breathing and relaxing.
You're using moderate pressure?
Yeah, moderate to
Only
light.
as much as you need.
Yeah.
Right? It's just a nice way to apply a broader amount of pressure when you use your elbow.
Sometimes the elbow feels better because it's more broad. Yes, correct. So now we're coming back to the bottom of the scapula there. Could you give me the book, and if you could bring me put it right here on next to her over here. Okay. Let's look at the infraspinatus here.
I will say though, laying like this really hurts my left hold on.
I'm curious if you treated her left side to see what happened.
Yeah, the left over here.
Yeah,
right
the
there.
same way that you did
Up a little.
on the right.
Like in
there,
there.
So what we found that was she was failing the left latissimus dorsi test. Remember? Yeah. So that one would cause pain right here. So let's take the latissimus dorsi and let's stretch it instead of contract it. Okay. So just put it, yeah,
Okay, that's
like
so
that.
much
Yeah.
better.
Yeah. Is that better?
Yeah.
So she was contracting that muscle, and
It's
so
causing you trouble.
she felt it.
Yeah.
So we'll just
Try to make
give
her
it
a little more comfortable.
Okay. What do you think of that now?
That's better.
She's not contracting it. So
Right.
so that muscle here, the latissimus dorsi, is bothering her. So one way we'll know it's better is if she could put the arm in the other position and it wouldn't bother her. Yeah. Okay, so so that's our infraspinatus, and how do we know if we're better with that one? So she'll be able to come all the way up here and touch the superior spine of the scapula. So she's oh, that's pretty good. That's pretty good. Yeah. Okay, press your hand down towards my hand. Push down. And relax.
Hello.
Oh, you notice that? Okay. Let go. Relax. Okay, good. So it's coming closer, but it's we're not all fixed yet.
I'm a very long work in progress.
We all are.
Well, you'll know it's totally fixed when you can come and touch all the way up to here.
Okay.
Okay. So that's our infraspinatus. So another muscle we're going to treat is the deltoid. So here we're going to go ahead and take a look at the deltoid right here. And so how's the comfort of your arm right here?
That's fine.
Pretty good.
Mhm.
So we're going to take a look at the deltoid. So I can feel some taut bands right here. Can you show us the deltoid? It's number 2.
Number 2.
Mm-hmm.
I can show it on here.
Mm-hmm. And the deltoid is on page 624.
Number 2.
Mm-hmm.
We're looking here at the number 44 protocol.
Mm-hmm.
You can see the muscles that refer pain there and the way that the trigger points are patterned.
Okay, here we go.
Okay, great.
And the,
So
in
here's-
the nerve root, C5.
Mhm. Right.
I'm seeing C5 on
That's right, C5, C6. So this is your deltoid, and here's the referred pain pattern. So here causes front of the shoulder pain and outside of the shoulder pain there. So that's our deltoid. So we're going to take a look at the deltoid. So we're going to treat it a little bit while we're moving it. So it's so important for us therapists and everybody that wants to be able to use their hands and arms to be to know how to pass these range of motion tests and to be able to fix these muscles.
That point right there.
I feel it. I felt that right there.
That gives me
Yeah.
a lot of problems.
Yeah,
So
I
that's the
felt
trigger
that.
point, right?
right there. Yeah.
And does that refer down to her wrist?
No.
No?
It doesn't. No. Deltoid. This is everything that refers pain to the front of the shoulder.
Oh, all to the front, okay.
Once you go ahead and look at the pain pattern for deltoid. Go ahead, look at it right there, so you can see where does it go. Where does the pain pattern for deltoid go?
All to the front.
Just to the front of the shoulder, the back of the shoulder, the outside of the shoulder.
It doesn't go as far as the
Not
elbow.
as far as for the elbow. No.
Okay.
So it stays up there near the shoulder.
So her wrists are another project.
Exactly. Oh, but one thing that causes wrist pain, guess what? Subscapularis. Okay.
Oh, yes, the
So the
subscapularis.
frozen shoulder muscle
Getting back to
causes
that.
wrist pain. Okay. Gives
And
you
it can
pain.
cause numbness and tingling too, can it?
Well, not so much numbness and tingling, but it could definitely cause. What does cause numbness and tingling? Scalenes.
Oh, right. Scalings, okay.
Okay,
Those little
so
devils.
those little devils. Okay, so I can feel we have some taut bands in this muscle. So I'd say she should keep treating this till it stops hurting when you press on it, and also that when she could move it and it doesn't give her any pain or dysfunction. Now, a really important muscle for us to treat on her would be the scalenes. But before we get there, we're going to treat the supraspinatus on this right side. Supraspinatus, and that's also C5. We treated that already. That's page 539. So here's the supraspinatus. So you find the spine of the scapula, come just superior to it, and press onto it. Oh, she notices this one.
Well, that's where my tendonitis is. In the
Okay,
super-
so let's look at this. So what would be tendonitis of this muscle? So if this muscle is giving you pain right here where it attaches. That's called tendonitis of the supraspinatus muscle. How do you fix that? You make the muscle longer, and then it doesn't. Then you don't have tendonitis there anymore. So you could also have tendonitis on this side, but more likely you'd have it there. And then of course the tendon attaches right there. That's the tendon. So it attaches right there.
Underneath. That's underneath.
Yeah, underneath the acromion, right on the humerus there. So let's look at where it is on you. Okay.
So the doctors are looking at the tendons, and we're looking at the muscles and the nerves.
Well, the trouble with looking at the tendon is you can't fix it doing that. You have to make the muscle longer. So if you don't treat the muscle, you'll never fix it. All you do is treat the tendon and never correct it. Okay. So here is right where the tendon attaches, right there, right here.
Mm-hmm.
That's it. So that's where it attaches, right there.
Leslie was saying that's the most common muscle that's the culprit of rotator cuff injury.
It is. She's so right. Supraspinatus. So there's 4 muscles in the rotator cuff. Supra, infra. Then we got subscapularis and teres. So that's our.
Indeed.
Okay, so we're gonna just treat this.
Teres can be exquisitely tender.
Oh, it can be.
Tender teres.
Yeah, and Leslie, she'll remember area 13 and area 12. Okay, so this is the supraspinatus. We're finding it right above the spine of the scapula, and we're shortening it, and then we're lengthening it. Let's see, and we found some noise there. We're shortening it, and we're just noticing where the noise is coming from. Yep, I feel it right there. And lengthening it, just shortening, lengthen it. So this would be a great muscle for you to treat. So you can treat right above the spine of the scapula there, and then we're going to treat right where it attaches, right there.
But the supraspinatus can run to my finger and wrist, right?
No. No. The supraspinatus only come out here to the elbow, cause elbow pain and dysfunction. But sometimes when it comes out here to the elbow, it could activate another muscle that could come down there. So there could be a cascade of one activating another. It can happen. So it's not uncommon. So for sure, it could definitely happen. Okay, so one muscle, let's treat it on the other side. Let's treat the latissimus dorsi on the other side. Okay, on this other side, we're going to treat your latissimus dorsi, see if we can make it better. So we'll come over here and treat the latissimus dorsi on this side. So we already treated the nerve root for it. How comfortable is your arm right now?
Okay.
So good. Remember, this is so C6 to C8 is right there where we treated already. That would be its nerve root. But the muscle starts all the way down here. Isn't it incredible?
Mm-hmm.
Yeah. And then, but it comes all the way up there. Okay, so we're going to look at the latissimus dorsi. Let's see if we can find it right here. So we'll look at it for a second. So here's your latissimus dorsi, and it's attaching all over here on the iliac crest, over the sacrum, and all the way up the spine, and then here onto the humerus. Okay.
So I have a lot of pain right here.
Oh, okay.
And so I can't sit sometimes get up from the chair.
It's difficult. So that probably could be the psoas muscle, or the abdominals might be doing that. But of course, particularly,
what about the quadratus lumborum?
Well, it could be several muscles causing the pain there, yes. But this one here might be the one causing it as well. So this is
the latissimus dorsi.
So let's take a look at the latissimus dorsi here. So we're going to come. I can feel some taut bands right here. I feel taut bands right here. So I can feel some. So I'm going to write on those taut bands that I feel there could be a little bit of longissimus iliocostalis and latissimus dorsi. So how's that pressure?
That's fine.
She likes it. That's good. So I'm anchoring the pelvis on this end, and then I'm treating the taut bands that I feel there. And then come down here, I feel some taut bands here.
Because with the pelvis, you have a tendency to
Well,
move
if you
up.
press here and
It's gonna
it's
have a
tight,
tendency
you'll
to
pull the
move up.
pelvis up. Yeah. So I'm stretching it a little bit by holding it down.
So you're treating her on the stretch.
That's right. I'm slightly stretching it, even because that's what she's on the body support system. So the back is slightly stretched. So when slightly stretched, the taut bands stick out, and so then you can see them more readily. So when you're slightly stretched, the taut bands will stick right out. Yeah.
But if you had her bolstered like most people do, that would tense it rather than stretch it.
Well, most of the time I don't do it. Put the bolster there
Right.
because but
I don't
you know.
either.
Okay, so we're coming up a little higher. And remember, she had the dysfunction she had was that she couldn't put her arm in this position without it hurting. So this would be the strengthener for latissimus dorsi. So begin the hand this here. It felt a little better.
Mm-hmm.
That did. It feels a little better. Yeah, yeah. It's not so tight now. Yeah. She gets better so fast. She's amazing. Okay. So probably if we worked with you during this time when we're working on the arm, we'll probably see some big improvements over time. Yeah, as you're learning and as we're treating you. So if you can come to some of the other classes, that'd be great.
I'll be here.
She's coming.
Don't miss the front. You can't just do the back without the front.
Oh my gosh, I know. I've already scheduled it next week.
She's coming.
Yeah.
Okay, we got her. Okay, wonderful. And then we're coming to where it attaches.
So that gets really painful in there sometimes.
Mm-hmm. Can be really painful here.
And that's the attachment of the latissimus dorsi.
Mm-hmm. That's coming, but that's all the way over here.
Oh, you're not, what were you doing?
Oh, just
I
coming
see.
towards it. You know, coming
Oh,
towards
okay.
it.
So just going over.
Mm-hmm, mm-hmm. Then we like to treat all the way onto the attachments, if we can. And then this, oh, you know what you noticed
Not
there.
ready for
So
that.
the top, the front of my inside of the shoulder.
Starts pulling.
This
Yeah.
one? Mm-hmm.
Yeah.
Starts pulling.
Okay, great.
Front of the
Okay.
shoulder.
Front of the shoulder. Front of the shoulder. Exactly. Exactly.
Treating the back. Fix the front. Yeah, I think
Oh,
we're gonna
it's
take
time.
a break pretty
we
soon.
are going to take a break. Okay, so
a little
it's probably
intermission.
we'll have a little intermission so everyone could, do whatever we want to do. Okay, so let's go ahead and take 10 minutes. So let's meet back here at
Come back at 7:20.
yeah, 7:20 sounds
we'll be
good.
back at 7:20.
See you
everyone.
7:20. Okay, so we'll make a little note and we'll put it down so and then say that we
Thanks for attending part 1 of 2. We're just gonna keep broadcasting here. This has been the first part of the Bodyworkers Mastercourse on front of the shoulder pain. We'll see you soon.
Water didn't last even a few steps. Fill it up again. Didn't get very far at all. It's from the dryness of the heat, I don't think.
which one of the things that we saw do you, on you, do you want us to take a look at you?
The left is the one that was injured.
I know, which one, remember we didn't pass the range of motion test, which thing would you like me to correct? That was, I don't want to know where the pain is. What I want to know is which one of the things you didn't pass. Okay. Why are you showing this to me?
I'm just wondering, is it okay for me to ask that question without worrying anything?
No, it's not, it's okay. Yeah.
It is okay, or it is not okay. You said no, it's okay
It's okay.
to ask. Okay. Great. Okay,
Okay, so which ones? So you failed the scaling reflection test. And you failed the circle extension. Flexion. Okay, what else? Mouth wrap. Okay. Arm pull back, okay. Oh yeah, maybe that's. Okay. And then yeah, that's the same one. Yeah, so that's like your fit. Okay, we'll take a- You can't do it without me. You need to do it with me. And so, we'll have to figure out what to do. I have a
do you know all
newsletter.
their sizes?
There's a newsletter that has all their ages, and then you could estimate what size they have. So I was gonna get them all socks. So based on their ages, we could probably figure out
You
what
don't-
size socks.
You don't want to just ask one of them.
I asked now 4 times. This is the 4th time I've asked, so I still haven't got the information. So that's okay. So maybe we'll do it later. Okay.
She's just gonna wait for you.
Like till tomorrow, or you mean later?
I don't know when.
Okay.
Just, we can't do it tonight, don't worry. Thanks everyone. We're about to resume our class, part 35 of the Bodyworkers Mastercourse on anterior or front of the shoulder pain. Here we are, treating some front of the shoulder pain.
So, treating the scalene, so remember, take a look here. You can see the scalenes cause front of the shoulder pain right here. Really, really prominent. And remember, she didn't pass the scalene finger flexion test when we were doing it before. So we're gonna treat that muscle, these muscles. So we had her warming up a little bit. So often we treat heated with a little bit of heat there. And she has nerve compression here at the scalenes. So she's got a pulling up of the first and second rib, causing compression of the brachial plexus. So she has nerve compression in the arm from the scalenes. So we're going to go ahead and we're going to treat the scalenes. So here they are. So I'm giving them a little bit of a massage. So here's the sternocleidomastoid, here's the trapezius, and they're between those two. So they're right here. So we're going to go ahead and treat the anterior scalene. And it starts at about C2 on the transverse process right here. And we're going to go ahead and look at looking for taut bands. So here I find a little taut band right there. So I'm just going to go ahead and press on it. And I'm giving it kind of a medium light pressure, not too much pressure. And we're going to come down, and we're going to come all the way down to where it attaches on the first rib. So this is the anterior scalene right now.
I can feel that like going in the front of something.
Yeah, it goes all the way to the front and then down the arm and all the way down to
my arm too.
And guess what? All the way to the thumb and the first finger. Isn't that incredible? Just like carpal tunnel syndrome. Down to those fingers. Isn't it amazing? Now we're getting all the way down, so I'm touching right onto the rib there. So right where the muscle attaches onto the rib. We're just pressing onto it, and this is something you could do for yourself. You could press onto those muscles. So now we're going to come back here to where about C2 and on the transverse process there. Now we're going to go a little further back, this time on the middle scalene. And we're trying to see if we can pass the range of motion test. We're trying to see if we can do the finger flexion test. Okay? So that's going to be an important test.
You guys are treating yourselves over
Yes.
there?
Oh yeah,
She
we're
does that?
treating
Yeah.
ourselves.
We're not going to waste an opportunity.
Yeah, everyone's following along.
Scalenes
like them
are
out there.
important.
You know, we've got the
Doing this.
synergy here. We got synergy going here.
Yeah.
With,
That's it.
Everyone's going to be passing this finger flexion test.
That's right. We'll pass it.
We're doing better, at least. We're aiming for
Right? Yeah, we
improvements.
keep treating till we pass the test. Now we're going to come back up here just towards transverse this way.
Someone had a question. If a patient has arthritis, is there an alternative to the finger flexion test?
Well, the incredible thing is that arthritis is frequently due to muscle dysfunction. So, and when we get down to the hands, I'm going to be doing some really special stuff to show you how to get rid of arthritic growths, bony growths on the fingers themselves.
Oh, that's
so
very
this
exciting.
is really, it's going to be really exciting. So some of the bony growths, I've got, maybe some of the people that we've corrected will come in and show off how we fixed it. So many times where the muscle pulls or where the fascia pulls on the bone grows. And if we treat that fascia and or muscle that's pulling on it, now the bone recedes. Isn't that incredible? But a lot of
Yeah, they said awesome.
But
The
a-
person who asked the question.
yeah, so that's good. That's coming up. So this will be one of the last
Yeah.
classes we'll
That's
be
a great
treating.
question, though. Yeah.
We really, this is so incredible. I just want everyone to watch this whole thing and learn how to fix all of the neck, shoulder, hand, and arm pain dysfunctions, nerve compressions for yourself and your family, your friends, and your clients. So yeah, it's going to be
Even if they have
incredible.
arthritis, no matter what the age.
And all our physicians, if you have people with nerve compression, hand pain, elbow pain, remember the most likely cause is myofascial.
You guys some of you are using
I'm using
some
a
tools
tool.
now. Our
Yes.
handy jackknobber.
Okay,
Great for
so
stuff like
let's
this.
take a look here. She's passing it on the first finger. She's passing it on the second finger. She's passing it on the third finger. So she's passing the range of motion tests here for the
doing good.
scalenes. So this is good. We can test her later on the wall.
Yeah.
But so far, so
Yes.
good.
Improving.
Does it
Yeah.
feel a little better?
Yeah,
Yeah.
definitely. It's much
Yeah.
easier now.
Yeah, she can do it. Isn't that great?
Yeah.
So it's a great start.
And that
Great
didn't
start.
even hurt what you did.
Isn't that wonderful? So that's because we're looking for the result, and we don't always have to use a lot of pressure, but we're looking for the painful spots. But many times, just the right amount of pressure gets you your result. Okay, the next muscle that we're going to treat. So we treated the supraspinatus. We treated the infraspinatus. We treated the deltoid, the scalene. Okay, now we're going to take a look at treating the latissimus dorsi.
Looking back at our protocol number 44 again, which you can find at myopain.com.
We're going to treat the latissimus dorsi in this position, side lying, and we're going to treat the pecs over here. So, and then we're going to take a look at the biceps and the brachialis and the sternalis. So we're going to treat quite a few muscles in this position. Okay. All right. So it was great that worked pretty good. That was great. Yeah. Okay. So now we're going to take a look at the latissimus dorsi. So let's go ahead and how's that arm? Feel about that there?
Yeah.
Good, good. Okay, so we're going to put the latissimus dorsi a little bit on the stretch. So see, since it attaches here in the hip, I'm going to take the leg and straighten it, and I'm going to have the arm over the head as much as possible. Okay, so she's going to, so you can bend this one.
There's our pain pattern.
We'll get this one down.
Dorsi.
So here we go. So here we're going to, and while we're doing that, I think I'll put the heat a little bit up here, just to keep everything nice and warm up there.
So we're a little
Okay.
bit on the stretch, you said?
Yes, we're just a little bit on the stretch.
So we got her top leg back a little bit to do
So
that.
here we're going to stretch the latissimus dorsi. So we're going to look for some taut bands with our elbow, so I can feel some right there. Okay, so I'm going to go ahead and give them a little bit of stretch. What do you think of that one?
Yeah, I can definitely feel that.
Remember, these go to the front of the shoulder. Isn't that incredible? The front of the shoulder.
Yeah.
Look where we are.
I've had a lot of issues with that one. It's the
You've had
culprit for a lot of things.
It's like amazing, right?
Surprising.
How could we have that? How could it happen? So I'm anchoring the hip down. I'm pulling with the left, pulling it back and stretching the bands, and I'm holding down the hip with the right.
So you're only applying pressure here with your left elbow.
That's
The other
correct.
one, you're just holding it in.
That's correct. And you notice I don't use my hands part of the time. So that's using less repetitive, I'm using more parts of me instead of using the same part
Good for
all the
you
time.
as well.
Yes, I'm fixing me. I'm fixing me. Okay, so while I'm treating people, and also I had noted that my bone density tests show that all this using my body to do the pressure work, all my bones are dense. So I'm getting probably a goodly amount of muscles and are pulling on the bones and causing the bones to get denser, which they found to be true in people with osteoporosis all the way, women all the way to over 90, and they found when they just did weight-bearing exercise, that's kind of what I'm doing here, that they increase their bone density.
Basically staying active thoroughly. Yeah.
Right. So even doing this work, so even doing the treatment on ourselves,
Using your own weight.
on other people, we're actually doing some of that too, apparently. Yeah.
Right.
So we're keeping up our bones.
So they should do a study with
Yes,
Bodyworkers
yeah.
and see,
Yes, and see how
you know,
we do it.
especially
Yes.
postmenopausal Bodyworkers. There's a lot of them, and see what their bone density is compared
That's
to
it.
the other
average.
population.
Yeah, we could do it. We could definitely do
Very
it.
true.
Okay, so here we took a look at the lat there, and we're going to go ahead and look at it a little bit more in this position and move it a little. So I'm just going to see it moving. So I like to see the muscle moving, and I like to
There you
feel
go.
it moving.
Oh yeah.
It looks good so far. So it's working. I can feel it's working. Good. Okay, so we did pretty good on our lat. Another muscle we're going to treat is the pec. We're going to treat it in this position. Okay, so the part of the pec that causes really bad pain in the front of the shoulder is this upper part right here. Okay, right there. Now, what could cause this to get tight, dysfunctional? What do you think? What do you think?
Pulling.
So having it forward, in this forward position. And guess who does that? A lot of people who sleep on their side go like this and shorten this section here. So one thing we could do is lengthen it when we get up in the morning, or not shorten it to begin with. Okay? So,
Or crouching over your computer, or
Yes.
looking over your cell
And
phone.
Yes.
driving.
so
Basically,
Driving.
So here
modern
it is.
daily life.
Everything we
Modern
do.
daily life. Correct.
So everyone can use some counteracting exercise. and
So
treatment
here,
for
the
this.
section that we're working on here, it attaches onto the collarbone, and then comes and attaches onto the arm. So here, attaches onto the collarbone, and then here onto the arm. So we're going to take a look at that, and we're putting it slightly on the stretch while we're doing it. So I've got it slightly on the stretch, and then I've got one hand here, and I'm noticing is what I'm doing, making it stretch a little bit. I'm asking the question as I'm doing it. You know, I'm
Yeah, you're
noticing.
trying to notice
I'm assessing
any differences.
any
you're doing
differences that I'm noticing. Yeah, we're making it longer. Yeah. So here it's starting to get a little teensy bit longer. I can feel it.
Responding well to that.
That's it. That's it. It's coming along.
It
So I
used
feel
to
some bands right here.
spasm if I leaned over for more than a couple seconds.
Leaned over.
Like if I was at a desk standing and I leaned in
going
that
like that.
position, it would get stuck and start spazzing.
Oh, okay. So then that's no good. Yeah. No. Yeah. No good at all. No good.
And what actually causes a spasm?
So that's a dysfunction. So trigger points can cause you to have muscle dysfunction like that. So that's one kind of dysfunction you could have.
It's just a particular type of reaction.
It's like it's ratchety. It could spasm.
When you don't have full range of motion. And
You don't have full control
do
over
something.
it. When you have so trigger points are a dysfunction at the neuromuscular juncture, at the juncture between the nerve and the muscle. Okay, and if that juncture is not working right, you could have ratchety, you could have spasms. So, and you could have just short muscles that don't, and you could have muscles that press on the nerve. So all of those things could be giving you trouble. Okay, so it's doing a little better. Okay, so this one here, so this test we didn't do. We did the standing test. We checked that, but we didn't do the laying down test.
what you're looking for.
So
Some
measuring
charts?
tape.
A measuring tape. We've got tape.
Oh, we've got
Okay.
that.
We got it. So one way I like to measure for this is I like to put one hand on the waist, and then everybody at home, when they go to bed at night, notice, can they get their elbow down? So go ahead, so right now the elbow's doing pretty good. Okay, but if it didn't do good, then you know you're supposed to treat that spot. So here, so that's 6.5 inches. So it's nice we could get maybe down to 4 inches, something like
So
that.
should your elbow touch the bed when you're laying like that?
Well, not
Or-
necessarily that far, but that'd be fine if it did.
Well, we got to know what we have to work for.
If it could come back to at least where the spine is, so if you can come back to the spine, that would be great. So here, we're making it a little longer. It's coming along. It's getting a little longer. It's coming along. So don't sleep with your arm forward if we're trying to fix
Just
this
put your
part.
hand maybe on a pillow or two
Yes.
so that it's not like
Mhm.
falling
Yes.
forward, correct?
So that's correct, yes.
If you do sleep on your side, which you don't absolutely recommend.
Right.
Correct. So
I know
if
you
you could-
recommended a 3/4 sort of sleeping style for
That's
people
one
who
way.
like to sleep on the side.
So here, if you could have a pillow behind
Oh,
you
that's a
like
good
that.
way, yeah.
So something like this, or your partner, you could put your hand on your partner. So instead of reaching forward,
Be
you're-
it a
instead of
pillow or
hugging
human.
your partner this
Yeah.
way, don't do that. Hug your partner this way. Okay? Or you could put your arm on something behind you there. Okay? So I had 2 people in Hawaii, husband and wife, and they both had pain in their shoulder from going forward like this, both of them. And they spooning and putting their arm in that position. Yeah. They both had trouble there.
Spooning syndrome, yeah.
Spooning syndrome. That's it. Yeah. So here it's coming back really nice. So let's take a look at our
Leslie's making jokes.
She is. Okay, so look, it's coming down. So here now, we're gonna just take. Oh, now it's coming down.
yeah.
That's
So
true.
it's
She made a
5
good point,
inches.
though. Her
Oh my
joke.
God.
She said
Okay.
partners have a tendency to move. Maybe pillows are a better alternative to partners.
Okay, now another muscle we're going to look at is subclavius. Okay, so remember it's right under the collarbone, right here. And remember, it causes such horrible pain. Remember, go ahead. She's going to show you the pain. It causes it all the way down to the hand, the front of the arm. It causes it the lower arm, the upper arm, and then down to the hand, the thumb, and the first 2 fingers. Isn't that incredible?
C5 and C6. Again.
That's right. That's C5 and C6. And we did find that we had
we treated.
trouble there, and we did treat that. So we're going right underneath the collarbone. It's a little bit painful, right?
Mm-hmm.
Yeah. So I can feel it. I got some
So you're
taut bands
going
right there. And I'm pressing on it.
underneath.
Right
Like on the
underneath.
lower side of the collarbone.
Yes,
Yeah.
the lower part of the collarbone. Correct.
Yeah, how can you make sure you don't come in contact with the subclavian vein?
It's not there. Yeah. So it's not right there. So it's
So you don't have to worry about it.
That's correct.
Where would that be?
We could show. So the.
So that's not
this
a
is-
danger.
No,
in
so
this.
because we're going to go, see, we're going right here towards the clavicle, towards the clavicle, towards the clavicle. So we're doing fine there. So we'll look at it when we're doing the pec minor. We'll take a nice nice picture of those. Okay, so we're doing really good here. I'm just going to move it a little bit. Now we're going to take a look at pec major and pec minor. What do you think of that? Okay, so let's do the outer border of pec major. We did the top part of it. Let's do the outer border right there. So this is the outer border.
Oh yeah, that's a good one to see.
She's going to show that. She's got a picture of Travell doing it.
Nobody likes this one. Nobody likes this one.
That's
Travell.
true. Very true.
Travell was
I can
doing it.
attest to that.
She's aware of this one.
We're aware.
Okay, now we're going to take a look at the pec minor. So can you open it up to pec minor?
Yep, come on.
Okay, so here's where pec minor attaches, right here, and then down here onto our ribs. So take a look. So here it attaches here onto our ribs, just like that, and then onto the front part of the scapula. Okay, so let's look at the little nerve pictures. See the little nerve. So see if you can find the it might be in the scalene one. So if the scalene would be number 3.
Treating the pec
Pec
minor.
minor.
Oh, here where we
There it
we
is.
see. Here,
Okay,
here's where we see.
show the picture. Yeah.
Yeah, this is a good
So-
one.
So here,
Yeah.
so here's the so here's our subclavian, and this can get all compressed by the pec minor here. So what you want to do is press on the pec minor. You press onto the subclavian artery and vein, but then you get right off of them. And then if you make this longer,
Well, it looks like that's the
That's-
brachial vein and artery. The
Yeah.
subclavian vein they cut out of this particular image.
oh, okay,
but
sorry.
this
No, here it
subclavian-
is, but it's kind of hidden in the back.
I think
See,
it's this one. Yeah, it's that one.
it's the one that's cut. It's kind of
Yeah.
deep in.
Yeah.
Mhm.
So you're not really going to contact it.
Not really, yeah. But even if you did, it's okay for a short time. You know.
And that feels very tight in there, like
Yeah.
right there. Oh my
Yeah.
gosh.
So here, remember, we're trying to pass this range of motion test. We're going to listen to our watch, and then we're going to come back and take the arm. There it is. So you can feel the resistance right there. So I'm just going to hold it there. I'm using kind of medium pressure. How's the painfulness?
I mean, it's fine. I can
Medium
just definitely
painfulness.
feel
Mhm.
like that I can't move it anymore.
You can feel how it doesn't want to move anymore. Yeah. So here's what you want to do is you want to listen to your watch and take your arm back. That's just to the amount that feels comfortable. Okay. So and then as soon as it gets more and more flexible, you take it further and further back. Okay. So that's how we treat our pec minor. Okay, great. So we've done most of the muscles. Let's see if we did them all. Let's check them all.
Ouch. Ouch indeed.
Oh, we didn't do the sternalis or the coracobrachialis or the biceps. Okay, so we have to do that one. Okay. Okay, so let's go ahead and let's look at the sternalis. So here we're going to get right on the sternum. So we're going to get right on the sternum, and then also I'm going to just take the arm back a little bit like this. There you are. Yeah.
So there's our pain pattern.
There it is.
Cool.
And it's C5, C6, C7.
And it can
C8,
mimic
C1.
chest pain too.
Yes, yes. So a lot of these muscles, all the pecs and the scalenes, could make you think you're having a heart attack.
It kind of feels like that, yeah.
Yeah. Mm-hmm.
Especially if you're a man.
And women,
because the symptoms are different for women. But
but yes, you're right. But sometimes, I just had a person that had a heart attack, and they had only felt pain up here in their mid back, between their shoulder blades. Yeah, a guy.
Oh, that's
Yeah, a guy. Yeah. But they fixed it. And then they put a stent in, so he did just fine.
Good.
nice to know. He's on the right side of the dirt today.
He didn't die.
The right side
Okay.
of the dirt.
That's it. The right side of the dirt, not under, on top of it. On top of the dirt. Okay, so here is our biceps muscle. So here's attaching. So you want to give us a little picture of our biceps? So here's attaching here and attaches here. So it's here on the front part of the scapula and also here in the bicipital groove. And then comes down, and then attaches over here. There you are. Okay, there it is. So you can see how it's attaching here, and into the forearm, and then here up here attaches into the bicipital groove and into the anterior part of the scapula.
Is that what they mean by being in the groove?
That's it.
Yes.
So how's that painfulness here?
Right there's, I think it hurts the most.
Okay, remember this causes pain in the front of the shoulder. So here we are, causes pain here in the front of the shoulder. Now, one of the troubles with this one is everybody is bending their arm all the time. So for this one, the main exercise for it is unbend it. So just don't have it in the bent position all the time. So that's this one here. So I'm taking it out of the bent position and I'm putting it here in the stretch position. And I'm lengthening them, so as I'm putting in the stretch position, I can feel the taut bands that are sticking out. And those are the ones we want to make longer. Okay, so we're going to make those longer. And remember, it's going to get rid of front of the shoulder pain, right? Also causes antecubital pain. Pain in the front, right here. Antecubital, that's a funny name, right?
Yeah. Are there any cubitals in there?
Some things have funny names, right?
Yes.
Okay. So this is very dysfunctional here because when I treated it, stretching it, it had good, but I could see it will not contract. So one of its dysfunctions is it doesn't want to contract.
Weakness?
No. It's pseudo weakness. It's, in other words, it won't contract. It's dysfunctional. It's really
You can add this to the list.
Right. So what would cause that?
it causes it from having your arm in the bent position all the time.
So my work. All I
So
do is
whenever your arm is in this bent
Right.
position, so eating, sitting at the computer, mousing, using what
modern daily life.
driving, okay, driving, and anything in this position will activate it. So what's the answer for it? Putting it in this position. So this is what I do. So I put the hand in this position a lot. So if you see me walking around, you often see me putting it in this position because I'm kind of trying to contradict the tendency for us to always have this arm bent. So if even a lot of people who have this trouble, I'll see them, they'll be walking around, they'll have their arms like this.
Like walking around like a T-Rex all the time.
Or like
T-Rex
this,
syndrome.
like a T-Rex. They're kind of like, they got their arms.
Spooning
Or on your
syndrome.
phone.
T-Rex
Yeah, okay.
syndrome.
The other thing
Yes.
is people are
Oh,
on
yeah.
their phones like this.
Yes.
Okay, so it's the muscle that you use to be on your phone like this.
And then they're looking down.
Okay,
on the
so
cervical.
it's like this,
too.
or like this. Okay, so this, but then people what do they do when they sleep? Okay, so you could have
Fetal
8
position.
hours of this. Okay, so all the time, this is like the most shortened muscle here. So this is a really big shortened muscle. So what we want to do is make sure this muscle gets longer. Okay, a lot longer.
You better hit her too, because I don't know what I'm doing.
So we want to make sure it gets longer, okay? Mm-hmm. So I can feel it's very lumpy here. Okay?
Right.
So one of the dysfunctions is it's short, and we can't get it to contract, so then it would be profoundly weak then.
Okay.
Then you
Yeah,
got
that's why I was asking about
yeah.
weakness.
But I'm
Yes.
saying it's why is it weak? So it's just when people say weak, they think it's weak because you're deconditioned. It's not deconditioning. It's weak because it's short.
Okay.
So it's totally different reason.
Okay.
So whenever you say, oh, it's weak, then they think strengthen it. That's what causes people to have really, 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 really bad myofascial dysfunction. That's how to send people off into the ozone.
Oh, okay. We won't strengthen it.
Strengthening dysfunctional tissue causes you to make all the myofascial dysfunction worse everywhere.
So then I've been telling my clients the right thing because they say, oh, well, I need to exercise more, I need to work out more, and I say you need to deactivate the trigger points first.
That's
and
right.
Stretch out gently and then strengthen. Have I been telling them the right thing?
That would be very excellent advice.
Okay.
Got hearts on that one.
Okay, so in different parts of the country, I've been coming to visit that part of the country, and say, for instance, in Indiana, Elkhart area, I have nurses, doctors, accountants, all kinds of people that have been very, very, very injured because they were weak and they had done those strengthening. And
Everyone's saying things like, "Oh, that's so true. That's so true."
It is true. It's all true. It's all true. Okay, so it's a little better. It's a little better. Okay, so what's better is there.
Whoa,
that part
nice.
was better,
We
but not
got
that
something
part.
there.
Not that part. So
Okay.
so what we want to do is keep treating it till we can contract it all the way and stretch it all the way without any dysfunction.
And it's a trigger point
Yeah.
that
So
is
it's-
probably loaded with all sorts of toxins and chemical wastes.
Yes. Well,
That's-
it's not
that's-
just
that's
what they found.
causing irritation.
Okay, what they found in the muscles that have trigger points. This is what they found. It had what they call substance P, and it had sensitizing chemicals. So what they did is they put a hollow acupuncture needle in there, and they found the sensitive area. They put it in, they pushed out the sensitizing chemicals, and the one that was in there that was really important was substance P. And then there was also interleukin 1 and 6. There was also prostaglandin. There was chemicals plus.
Does that
There
have
was
to do with
low-
the immune system? Interleukin?
Nope. Oh, they used it. It was used for many things. They found it. Yes, correct. It's a $30,000 to $50,000 shot if you don't have it. So interleukin 1 and 6 gets caught in there. Also low pH and no ATP. So there's no ATP.
There's a little bit of research that's
No
in there
energy.
on this.
Yeah. So there's
the
no energy.
mitochondria. The mitochondria
So
is
one reason it can't
sleeping.
contract right is because it doesn't have any food. Okay, there's no food for it to eat. Hey, it's a little better now. You got that section
is.
working.
Yeah,
Okay.
it feels better too.
See, so it's coming along. Okay, so that would so I like to at least get it about 30% better, if not between 30 and 100%. So at least if 30%, that's good. So it's definitely better. So I'm glad. So we did really well with that. So let's see, did we do all of the muscles? Oh, coracobrachialis. We didn't do that one. Okay, so let's go ahead and look at Court. Thanks for helping Linda with showing all the pictures.
Oh, sure.
That's great. She's a big help. Okay, so here we're going to feel the coracobrachialis. It's right here.
I can find it.
It causes
Here we
so
go.
much
Oh,
pain.
yes.
Okay, this coracobrachialis. Again, it gets dysfunctional from, guess what? Having your arm in this position again. Same thing. Okay. Okay.
Take a look
we're
at
gonna show
that.
it. There it is. And this one can compress a nerve, the musculocutaneous nerve, and cause nerve compression in the forearm. Okay, so that's great to know. So here, this one here is the coracobrachialis. So I treat it a little bit in range of motion. Here, I'll treat it a little bit while we're just got it in neutral position.
And that's all. It's really tender in there.
She feels it, and especially right here. This is right where it would compress the musculocutaneous nerve. The musculocutaneous goes right through there. So it causes numbness in the hand and arm. So she has 2 nerve compressions that we found so far: the brachial plexus and the musculocutaneous nerve. What do you think of that? 2 at least.
I'm sure I have like 30.
We could find in the arm. You can have up to maybe 11, 12, 13 nerve compression areas in the arm. Yeah. By the muscles. Oh, we also found that we did find some also at the nerve roots. So 3 areas. It was at the nerve roots, at the scalenes, at the brachial plexus, and at the musculocutaneous. So 3. No wonder she's having trouble. Okay, so I think we found some improvements in all those. So we found them so usually I keep testing right as I'm going along, and we saw that everything improved. So that's great. So I'd say that it's likely that if you continue to do the things that we're suggesting, that we'll see some improvements. Okay, great. Okay, let's have you go ahead and sit up. So if you can feed yourself a little bit every day, that would be great. Put your feet over the side there. And then go ahead and stand up. Okay, good. Okay, so what I'd like you to do is we're going to have you move a little bit. So all of us, let's move together. Okay. So some of the muscles. So for the scalenes, we're going to go ear to our shoulder, ear to our shoulder, ear to our shoulder, ear to our shoulder. Good. So that was a really important one. Okay, another one was these muscles here along the spine, right? So let's go ahead. We're going to rotate and look over our shoulder. Really look and rotate. Look over our shoulder and rotate. Look over our shoulder and rotate. Good. Okay, another muscle that we want to look at is the supraspinatus and the infraspinatus. So that was coming up like this, then coming across like this, and then coming around like this. Okay, so the exercise is coming like this. So we could do each arm. So they go like this. So this is it. So let's go like that. So this is for the infraspinatus, infraspinatus, supraspinatus, supraspinatus, anterior deltoid. So this is getting these. Okay. Now that's another stretch for us is taking the arm across to the opposite side, across to the opposite side, across to the opposite side, across. This is for the infraspinatus, okay? And then the next one for the infraspinatus is coming around like this, and coming around like this, and coming around like this. So then the infraspinatus, supraspinatus, also the latissimus dorsi. Let's go ahead, let's do the lat. Let's go ahead. We're going to contract it a little bit, and then take it up over our head, and contract it, and give it a come forward and contract it. They come over our head. You could just do whatever's comfortable, okay? And then do the other side. So we're going to contract it, get over our ear, contract it a little bit forward, contract it, come behind the ear. Good. Okay, so how'd that feel? Good, so far so good? She's moving. She's moving. Okay, so for the deltoids, let's go like this. And let's go like that, and go like this, and go like that, and come behind, and go like this, and come like this, and go like that. And then we're going to look for the pec minor. You're going to listen to your watch, and take your arm back. And you're going to listen to your watch, take your arm back, and listen, and back, and listen, and back. Good. And the pec major. Take our arms back, back, back. Okay, I see you got a couple pec major things to look at there. Okay, okay. So let's see. Did we catch all the muscles? Okay, the biceps. Let's do the biceps. Okay. So we're going to shorten it and lengthen it, and shorten it and lengthen it, and shorten it and lengthen it. And then we can do it in different positions. So here we could shorten it and lengthen it going this way, shorten and lengthen, and shorten and lengthen. Okay, but another way we could do it is like this. We can use the wall for help. So let's come this way. So all of us come this way. Keep coming. Keep coming. So let's put our hand on the wall, and you can see if you can get your arm close to the wall, and have your palm towards the wall. And then turn your palm away from the wall. Turn your palm towards the wall, palm away from the wall. And you can put it in different, towards, come down lower, towards and away. And then this, so you're getting your arm here and you're really stretching that biceps. Let's see how you're doing. What do you think? How's it feel?
Okay.
What do you think of yours?
A little bit painful.
So what you want to do is come more and more, over time, get further and further like this. You know, so you're coming.
Right.
You know,
So you're facing forward.
Yeah. Yeah. So you can start. They can start out this way.
But, okay.
But then over time, let's get to where we've got the arm here.
So your body's supposed to be facing
That's
front,
Right, that's right.
Okay.
but your arm.
That's
that's-
why I was like, oh,
that's
this is
That's
good.
perfect to
I
start.
was cheating.
That's good. No, that's a good start. Okay.
Okay.
A very good start. Try it on the other side. So throughout the day, if you could get the arm into this position. So throughout the day, if you can put it in this position. And just remember the other thing for this one is, remember, what is it? We're just going like this. We're just going to put our hands behind our back like this. So let's all do this.
So just to be clear, it was thumb up and then thumb down.
That's correct.
Yeah.
Yeah. And another way of doing it is unbend the arm, right? So here we're doing it. We're unbending, right? So we're just coming like this. Or just putting one hand here, one hand here, like that. So we're just unbending the arm. Unbend. So this is for the biceps muscle, the biceps, anterior deltoid, coracobrachialis. So here it's doing all these here. This is such an easy exercise. Just coming this way. Come on in. I think we did it. I think we did it. Okay.
So those
here's
are range of motion encouraging stretches.
That's it. And these are some of the stretches that I put on the back at the last page of the protocol 44. So we're going to take a look at one of your muscles that we had trouble with. So the one that we had most trouble with was the pec major.
Okay.
Okay. So let's take a look at you. Okay. And we'll see, to get a little bit of pec major done.
We've got about 5 minutes or so.
Right. Okay, so let's have you lay sideways. More left than right, okay. How's the comfort?
Is this okay?
Okay, let me get this under your neck maybe, like that. How's that? Is that better?
Sure.
Okay, good. She likes it. Okay, so we're going to take a look at her pec. So remember we tested her and she couldn't get the arm back. So here we're going to just look at it in the back position.
Pec major?
Pec major. Correct.
Okay.
So we're taking a look at pec major. You can see.
Pec major.
So you can see how it doesn't want to go back. I can feel it. See, I can feel here it doesn't want to go back.
That's it.
It doesn't want to go back. And Linda, she was perfect at this. Perfect.
She's got one fantastic muscle there.
She was perfect.
I'm glad there's something I'm perfect at.
Oh.
Gives one cause to hope.
Yes. So one of the people who became a trigger point therapist in Indiana, he started at about 62 or 3 years old, you know, maybe 64. And he was all dysfunctional, all in pain. And all.
That's how it
Now
starts.
He lost a lot of weight, and now he's a therapist, and he's been fixing everything all the time, and now he's passing all the range of motion tests. I think he passed, you know, all of them after about 6 months or a year. And now he's got 2 clinics.
Wow.
Oh.
Who's that?
Steve, yeah, in Indiana. So he did good starting out late.
There were some calls for you to come to Orlando earlier. In the
We
podcast.
want to come to Orlando.
You want to come?
We want to come to Orlando. So the Orlando people, tell us your name, send us your email. And
We'll come to you.
We'll find the time to come to Orlando.
Yeah, like February maybe.
Yes.
Now I have a place to stay in Daytona, which isn't too far from there.
Yeah, your friend who just moved there this year, so I have a place to stay in Orlando area.
Yeah, yeah. So it's you girls. Is it winter? Is it winter?
It's winter here.
Yes, it's
Everyone
winter
wants
here.
to come to Orlando also.
It's winter here.
And Fort Myers also.
Oh yeah, Fort Myers is great.
Yeah.
Miami.
Someone's saying they want to be a patient. Well, if you want to come visit in Chicago, you can definitely also be a patient here. We try to also do seminars and make visits around the country.
Yeah, we'd love to come down to Florida and train people. That'd be great.
Yeah.
So we have some great workshops there. That'd be super.
Yeah, you can email us at info@myopain.com.
It'd be great. We'd love to know where people are. And who wants us to come visit them?
Yeah.
Wow, this arm wants to come back now. Look at
It's
this.
doing
Woo,
better.
woo, woo, woo. This is a nice arm. Okay, so since we did the pec major, let's try the pec minor.
Oh,
Okay.
yeah.
So let's try the pec minor. See if we can get the pec minor. So pec minor is coming along. Boy, everyone improves. You guys are improving so fast while we're treating you. You guys are amazing at improving. Just amazing.
Yeah, it's looking much better.
Much better.